Good evening, everyone. It is an honor to be here today to talk a little bit about encephalitis in low and middle-income countries, a condition that remains under-recognized, under-treated, and underdiagnosed in many regions where it has a devastating impact. The launch of a WHO technical brief is not just an academic exercise. It is a call to action. Today, we focus on encephalitis, but we could name many previous technical briefs that have transformed global health, from primary care to chronic diseases. In my country, Brazil, several goals of these briefs are pursued every day in our public health system. And if I may say, encephalitis is just one example of why working together matters. As we learned from COVID-19, diseases do not respect borders, politics, or ideologies. They affect us all. Technical briefs drive change by prioritizing neglected and emerging diseases, by mobilizing international funding, by standardizing guidelines and strengthening health systems. Cases worldwide, but we do know that infectious causes play a major role. And in low and middle-income countries, many of these pathogens are either emerging or being neglected. I cite here just one example. Virus is increasing in cases in South America right now and is yet barely studied. Without surveillance, these infections will continue to spread almost unnoticed. Encephalitis today is not a funding priority in many low and middle-income countries, not because it is less important, but because these countries face multiple crises. Lack of clean water, limited access to education, overburdening healthcare systems, is cause of armed conflicts. And in reality, it is difficult to choose what to prioritize. But encephalitis must be a priority. It has a high prevalence in children. It causes severe disability in adults. It leads to long-term social and economic burdens that are even harder for us, citizens of low and middle-income countries. A technical brief can make a difference. It brings visibility and encourage investments. And what's missing in most hospitals? MRI and EEG are unavailable in most rural areas. Many hospitals do not have lumbar puncture kits for CSF tests. Most cases are handled by general practitioners, not neurology specialists. A WHO technical brief provides clear guidelines to train health professionals, improve diagnostic and treatment pathways, ensure access to essential medicine. And what needs to be done? We need sentinel surveillance sites to detect outbreaks early. We need affordable and rapid diagnostic tools for different areas. We need expanded vaccination programs for Japanese encephalitis, for dengue, for chikungunya, for measles. We cannot afford to wait for the next pandemic to act. This technical brief is a roadmap for change, but a document alone will not save lives. That depends on us, healthcare professionals, researchers, policymakers. Let's prioritize encephalitis in low and middle-income countries. Let's push our authorities for better funding and diagnostics. Let's strengthen global surveillance and response. Health should not be a privilege. Health is a right. And the time to act is not tomorrow, it is today. And I hope to keep working on this topic with all of you. Thank you.